Hello, this is Dr. Michael Gray from selfpaymd.com, and I'm here for today's question of the day. So, commonly asked, when I am on a GLP-1 medicine like Wegovy or Zepbound, do I have to take it forever? Well, when I first started doing this, I used to say, it's really best to try and think of this as a way to help get you where you want to go, and then hopefully be able to come off of the medicine and then maintain with diet and exercise. However, in recent years, there's been a shift in the sentiment among experts in the field that in some cases it might be reasonable to continue with GLP-1s long term, especially with so-called microdosing. Um, so once you are at your goal, you can either stop cold turkey. It is considered medically safe to stop GLP-1s without any taper. You can stop at any time for any reason. For example, you can stop because you reached your goal. You can stop because you don't like the side effects. You can stop because the price is getting too expensive. So you can stop at any time. Now, the thing is, if you don't make any other changes whatsoever and you just go back to your old ways, the chance of regaining weight back is very, very high. So you have to do something different to try and maintain. Either be really aggressive with diet and exercise, or you could consider medication to help you maintain. Now, for medications, for GLP-1s, I usually suggest something like roughly half of what your previous high dose was, and then it can be adjusted up or down depending on how you do. And that can be done weekly, and some people even spread it out longer than that just to maintain. If you don't want to use a GLP-1 because of the expense, other medicines can potentially be used for maintenance, things like topiramate or metformin. These are older medicines. They're often used off-label because they tend to suppress appetite. Metformin is traditionally used for diabetes or PCOS. Topiramate is traditionally used for epilepsy, for migraine prevention. But in this case, they can be used because they tend to suppress appetite for most people who use them, and that can be used to help maintain weight loss after using a GLP-1. So the long and short of it is there's nothing that says you have to use a GLP-1 forever, but in recent years, more and more people are using them for maintenance, especially with microdosing, providing you don't have any major side effects, you don't have anything dangerous happening, like your body mass index is not dropping dangerously low, things of that nature. So as long as you're tolerating it well, at this point in time, there are no guidelines saying that you have to stop after some arbitrary length of time. GLP-1s have been around since about 2010. I believe Victoza came out in 2010, and that's over 15 years at this point. So there's been a pretty good safety track record for GLP-1s. But that being said, you just never know. There could be some other unforeseen long-term side effects discovered at a later date. 15 years is a long time, but it's not really, it's not a lifetime. So 10 years from now, 20 years from now, it is quite possible that there might be some other long-term detrimental side effect discovered. And it very well could be something that is not recommended long-term in the future. But as of right now, that data does not exist. Some of you who might have been around for a long time might remember phenphen, phentermine, fenfluramine. Back when I was in residency, that was all the rage and was very potent for weight loss. But in the end, after years of research, they discovered that fen harmed heart valves, and it was eventually taken off the market. So it does take a long time for these things to be discovered, and at this stage in the game, hard to say if that will be the case with GLP-1s or not. Hopefully not, but time will tell. And we'll leave it at that for this episode. So everybody have a wonderful 4th of July and be safe.